Representative Watson, thank you so very much. I am appalled and personally offended, and I think all owe an apology to those representatives who were demeaned, who were spat upon, who were cursed, and who were called the ugliest of names. It's totally unacceptable. Mr. Thompson, if you would.
Representative Garamendi, I couldn't agree more. And I think that Representative Watson says it well. There's all the call for civil discussion, exchange of information, to do things analytically and substantively when it comes to a huge industry that represents one of every $6 in this country. And we need to do it in a way that brings together the facts, not to deal with fiction. And emotion, obviously, is part of this discussion. We heard it from our friend Representative Ryan. We are emotionalized by this, but let's have the sort of dialogue that builds soundness into the reforms that we desperately need as a nation. And I think that when we get back onto this message of freedom, the freedom to shop, many of us understand there's a capitalist model out there. People understand that it's good to have business be successful. And where we can control cost and contain costs and allow for that growth of that business so that more jobs are part of that picture, all the better. And so we have the opportunity with these exchanges developed by this reform legislation to allow for the freedom to shop, to find a better bargain for health care, and to, as previous speakers have said, add more people into the mix, more providers into the mix that want to fight for the right to serve you. That is a strengthener. And when we establish these exchanges, where we require those exchanges to have certain rules to be met, in other words, to have regulatory aspects, so that we saw what happened when no regulation was part of the financial world and the banking community, it brought us to our knees in a recession. So we need that sort of regulatory aspect, and it's part of the picture. The medical loss ratio, the amount of money going back directly in health care to consumers, to those insured, rather than into the profit column, will be a litmus test in order to offer your services in that exchange and to live with a standards minimum benefits package. These are the improvements that we... So again, to Representative Ryan's emotion, and I attach myself to that sentiment, we are promoting freedom to shop here. We are promoting freedom from bankruptcy. These are essentials of this bill. And the exchanges will allow for much more competition that sharpens the pencil and drives the bottom line benefits for consumers. And the freedom to escape restriction and bias if you have acne or are overweight, or for women who are of childbearing years, or to those who have been perhaps violated through domestic violence. To use that as a standard to deny you insurance coverage, that's the freedom you need to escape those biases and that prejudice and that tool that allows the industry to grow more prosperous because it won't insure you. These are the freedoms we're encouraging. These are the freedoms we're guaranteeing. So I'm proud to be here tonight to work with you, Representative Garamendi, to make certain that we share with the American public what is really happening with this measure. And we're going to make history by approving this package.
Representative